Hi, I'm Dr. Thomas Polascik. I'm a professor at Duke University Medical Center in the Duke Cancer Institute. Cryotherapy has historically been used in the primary setting, which means the initial treatment for prostate cancer. It's been used in the salvage setting, meaning that if a patient has failed radiation, we can use cryoablation afterwards. And the reason we do this is because the side effect profile is lower than other traditional treatments. It's been used in the focal or image targeted setting, and it's been used in partial gland ablation, meaning that for some patients they may not have a MRI image, but they have it's called a pathological mapping biopsy, and you could determine or localize cancer to a certain region of the prostate, in which case we could use the ice to sculpt a treatment of that particular cancerous area of the prostate. I would say that the primary benefit when you ask patients is the overall satisfaction rate. I think most patients who've had it are very pleased. It has really minimal impact on their quality of life. The urinary control or continence rate, at least in my hands, according to our results, is 99%. No pad use, no leakage. And regarding erectile function, again, it depends on how strong the erections are coming in. So if a man has really strong erections, we can oftentimes preserve them. It also depends on where the tumor is located, how close to the sexual nerves it's located, the size of the tumor, and how much ice needs to be generated. So these are the variables that would need to be discussed in a patient's particular situation. So another benefit of cryotherapy is it does not require an overnight hospitalization. The recovery time is very quick, and it is a minimally invasive treatment, certainly less invasive than surgery. When compared to radiation, it's a single setting treatment, so typically the freezing process takes 45 minutes. Anesthesia would take 45 minutes, so your treatment is really within an hour and a half. As you can see, the prostate gland is located deep in the pelvis. And when we perform this procedure, what we're going to do is we're going to place these needles through the skin and an area between the scrotum and the rectum. These needles go into the prostate. These are specialized needles that grow ice balls. And then we overlap these ice balls or sculpt the ice to customize the treatment for the patient's cancer. This is how cryotherapy works. We have ice probes that are placed in. Ice is generated. Initially it freezes outside the cells. It gets really, really cold. The cells basically fracture, and then there's a number of other factors that happen. Immune system, what's called thrombosis, many mechanisms that kill cancer cells. So in general, side effects are minimal. We look at short-term and long-term ones. So you may have a little bit of bruising where the needles are inserted. There's typically no pain because if you think about it, if you bang your elbow, you put ice on it. So ice is a way of treating pain. So patients would say this is essentially pain-free. Other side effects are more on the unusual side. It's called a slough, or injury to surrounding structures. Again, those are more uncommon. The recovery is very quick. Patients go home with a catheter for a few days while the prostate's swollen after the treatment. Once the catheter's out, there's really no recovery at all. People are back to their usual activities or work. That's one of the benefits. Compared to surgery, one may need to take several weeks off, but with cryotherapy, you're back in your usual state of health and activity. The follow-up after focal therapy is important. We typically do imaging afterwards with biopsy. So remember, when we focally treat, we're treating an area or a tumor. We would want a biopsy to make sure that that cancer is gone. And also, the untreated portion of the prostate is on surveillance, so we want to make sure that over time, a new cancer is not developing. Prostate cryotherapy, in my opinion, is quite effective in treating prostate cancer. Again, it depends on how aggressive the cancer is. For low-grade tumors, it approaches 95%, I would venture. For the more aggressive tumors, it may be less effective. We typically have to reach colder temperatures for more aggressive cancers and also cancers that have been exposed to radiation therapy. So in those situations, it may be 60% effective based on the biology of the tumor. If cancer should return after cryotherapy, I would say most patients would choose to repeat the cryotherapy process, particularly if the tumor is still localized. But really no options are off the table. You can choose other energy sources. You can always have radiation, etc. Most men who choose cryotherapy don't really want surgery initially. So for the most part, surgery is not typically done after cryotherapy should the need arise.